Hello, everybody. Welcome to the FutureDDS Dental School Experience Series, where we help you decide which dental school is right for you. Now, every school is unique and will provide you with a different experience, and we thought to ourselves, who better to explain to you what a school has to offer than a student who actually goes there? Our goal in this series is to give you a first-hand perspective of every dental program in America and ultimately help you make the right decision. So, today we'll be showcasing Yalda Ross-Timnazan, who is a D3 at University of New England College of Dental Medicine. Yalda, how are you doing today?
Hey, I'm so excited to be here. Thanks for having me.
No problem at all. We know you're extremely busy, so once again, thank you.
Of course,
Thank you so
for
much.
you guys.
Thank you. So, Yalda, if you could, please tell us a little bit about yourself, where you're from, where you went to undergrad, and what got you interested in dentistry.
Yeah, of course. So I'm actually from Boston, Westwood, Massachusetts, born and raised. I go to University of New England, which is in Portland, Maine. But for undergrad, I did go to school in Boston. I went to Massachusetts College of Pharmacy, which you think pharmacy school, like, what do you
Yeah, I was like, hold on, what?
A lot of people are like, did you slip up somewhere? I'm like, no. So actually what happened was I started as a PharmD, and then about halfway through my first year, I was like, this is not for me. I was working at a pharmacy and I was just not having it. So I shadowed a few dentists and fell in love. I was like, this is what I want. This is what I want to do. So I developed a passion and I just went for it. So I switched my major. I went from PharmD to biology, and then I also minored in public health, got all my prereqs and got everything in a row and sent in my application.
Okay, that's awesome. That's awesome. So, did you take a gap year, or did you go straight from undergrad straight to dental school?
I did. So because I started a little bit later figuring out what I wanted to do, it was my junior year, and that's when I finally had solidified, okay, it's dental school. But at that point in time, I hadn't taken the DAT. I didn't really have any of my ducks in a row at all. So I decided, let me just take a gap year, and I applied in my senior year of college. So I did take a gap year.
Okay, and during that gap year, I'm sorry, you said, did you take like more classes?
So I actually, I had done all the prereqs and I had already taken the DAT. So what I did was I worked as a dental assistant at an office. I traveled, I lived it up. I did all the things that I knew I wasn't going to be able to do as soon as dental school started.
Right.
So I had fun, and I got a lot of good experience because I shadowed at different specialty offices. I figured out what is perio, what is pros, and tried to get that aligned so that when I started dental school, I'd have a little bit of a leg up.
So I want to ask you a quick question, because you're actually the first interviewee who was a dental assistant. So do you feel like that, better prepared you for dental school?
Yes, 1,000 times yes. And the main reason, I actually didn't realize it until coming into clinic. So I'm in my third year, which means I'm in clinic 24/7 except for Fridays. So being in clinic and working with students as your assistants, you kind of realize, like, we're obviously in dental school. We're here as our primary goal to become a dentist, not to become a dental assistant. And it really sticks out the people who've had dental assisting experience, and those are your go-to people. I mean, if I am having an assistant or if I have a student who's assisting me who has experience before, my day is from 0 to 60. It is dramatically better versus somebody who doesn't really know how to assist and knows how to be the doctor. So for me, definitely helpful.
Yeah, it's interesting. I like listen to all these different like dental podcasts, and they always say like your assistant is like huge to the success of your practice, So it's interesting that you would say that. Definitely. So I actually want to, go back to your school, University of New England. Now we know New England's a big area. So like, what city?
So when I first moved to Portland, I didn't realize that it takes like 8 or 10 hours to get to the other side of Maine.
Yes.
So it is a big state, and there is definitely a huge need in Maine for dentistry, which is why they even created University of New England College of Medicine, because there just wasn't a lot of dentistry going on here, and they were having to send people all the way to Tufts to be able to be seen at a dental school. So it definitely increased the opportunity for a lot of the people here in Maine. So that's great. Our school is in Portland, Maine, which Portland, I don't know if you've ever been here, but Portland, very cute city. It's like the campus itself is about 10 minutes drive from downtown. So for people like me who, are easily tempted with a good time, it definitely made it a lot easier for me to be a student and have my main focus be dentistry and not, bar across the street. So I love the location. It's, I mean, it's in Portland. It's close to South Portland, and it's also close to the Old Port. It's similar to like Faneuil Hall, honestly,
Okay.
is how I would explain Old Port. It's a
Mhm.
great area. And it's a 2-hour drive from Boston. So I definitely really like the location.
Mhm.
And Portland's fine. It's a cute little city.
And
So
so you know how some schools they're kind of connected to the medical schools. Do you have that type of situation, or is it just standalone dental
yeah,
school?
so our campus is cool in that we have a bunch of other programs. We don't have a med school on this campus, but we
Mhm.
have pharmacy school, we have a PA school, we have PT, OT, we have social work, we have nursing, dental hygiene. So we actually have a dental hygiene clinic, which
Right.
is pretty cool because a lot of our patients come from that clinic. So the hygienist will notice something and send them our way. So that's great. We get a lot of patients that way. There is a DO school about 20 minutes
Okay.
from our campus, and we do have a couple interprofessional programs with them. Our anatomy or gross anatomy lab was on their campus because they had the cadaver lab.
Okay.
So we interact with them a decent amount, but we definitely do interact. We have interprofessional programs between the different programs here on this campus, which is really great. So you learn how to, do med consults, talk to pharmacists, write script, things like that, that you don't realize until you've graduated, how
Right.
great.
No, that's awesome. That's a great opportunity, honestly, having everybody like around you. Yeah, I
Right.
wish we had something like that. But anyway, what about your class size?
So we are 63 people right now.
Okay.
It's small.
Okay. So do you know like the faculty to student ratio?
I don't know the exact ratio, but I've never felt like we didn't have enough help,
Okay.
especially when we were in sim clinic. There was always, I would say, actually, I do. So there were 4 students per each faculty member
Wow.
when we were in sim clinic, sometimes more, depending on how many faculty were there, sometimes less if people were out or rotating, but you always had somebody consistently right there when you needed it,
Wow, that's awesome.
which I felt was pretty good.
Yeah, definitely, definitely. Okay, so you're applying or you were applying, and you had all of these different options. What really made you choose to go to University of New England? Like, what characteristics about the school just really attracted you and enabled you to go there?
So great question. So actually, you go to Tufts. I had my heart set on Tufts. That
Oh,
was kind of like my school. I knew a lot of people that went there, and I had applied. I interviewed, and I was waitlisted for a while. So UNE wasn't really totally on my radar until I came for the interview.
okay.
Interview, walked in, fell in love immediately. I mean, you walk into UNE and everyone's so nice, but everyone's nice everywhere. It's really the facilities that I was kind of blown away by. I had been to other schools, I had interviewed other places, but when I came here, I was like, okay, what? Everything's brand new.
Right.
So we had like brand new technologies, brand new clinic. Everyone was super nice. And I just liked the fact that our program was so intertwined with other programs. Our campus was very involved. So the oral health center is directly next to the pharmacy school. So I have friends in all different programs, and it makes it really fun because like I'm on an intramural soccer team, and my soccer team is pharmacy students, PT students. So it's a really cool vibe here.
Right.
Dentistry wise, I really liked a lot of the faculty here that did my interview. Our interview actually was MMI, which is multiple mini interviews.
Mhm.
So you have 6 mini interviews, and it's like 3 or 4 minutes each. There's a question on the door. You have a minute to prepare. You go in and you just kind of confidently give your spiel, answer the question. And then later you have one group interview with the dean,
Mhm.
uh, which was kind of nice because you got a feel for who everybody else was at your interview. You got to know the dean on a more personal level. So really the interview kind of sold me, and just learning about the initiatives here and how heavily they were involved with public health initiatives, being a public health minor, that was kind of something that I really wanted to pursue. So you can graduate here with your master's in public health additional to your DMD, which is another thing that I was kind of like, okay, done deal.
So are you doing that? I know you said you might not. Okay.
After I graduate, it's like an additional 6 months, but
Okay.
yeah,
Okay. Oh, that's great. We definitely need more people interested in public health. So yeah, we
exactly.
applaud you for that. Definitely. And really quickly, you said that the facilities were like brand new. A lot of people don't know, but your school is like fairly new, correct?
Yeah. So our school is now in its 7th year, which is new. It doesn't sound like it's that new, but it's really new.
Yeah.
I was the first, so I was, yeah, when I got here, there were classes above me. There was second years, third years, and fourth years, but I was the first class to have a complete dental school.
Right.
So it was really cool. But at the same time, obviously there were a ton of kinks to figure out.
Right, of course.
How it goes, they're getting figured out. And it's really nice because if you have an idea or if there's something that you're super passionate about, you can tell the dean. You can just tell someone in administration, and most of the time it happens, or they listen and they kind of will adapt to what the students like, which I really like here. A lot of things have they've followed through on a lot of things that students have suggested, which I really like, because it is a newer program. But then what I didn't realize, again, until I was in clinic, was because the facilities are so new, there are a lot of things that we have in our clinic that other schools might not have, that private practices now have. So like we have a CEREC machine, we have the intraoral cameras, you've got your CBCT panel machine, 3D printer, endo microscopes when you're doing endo. We have like surgical suites for implants and perio surgery. So it's just got a lot more at your fingertips to use, and you learn a lot of the technology that otherwise you wouldn't at some other schools that don't have it. So that definitely is something that I think sets UNE apart.
And for everybody who doesn't or didn't know any of the equipment that she just listed, you definitely will once you come to dental school, because all of those things are not always afforded to dental school students. But with technology changing rapidly, there's always new technology and machines within dentistry that we might not necessarily have access to. So the fact that your school does provide you access is huge. So no, that's definitely a huge benefit. But now I actually want to ask you to, go back in time a little bit. I know it was 3 years ago when you interviewed, but a lot of our viewers are really interested in the interview experience or the actual process of the interview. So if you could, can you kind of just like walk us through that day of like your entire interview?
So you get here, very, very nice vibe. You walk in. There was, I don't know about how many people there were, but I would say probably about like 30 or 40 people. We were split into 2 different groups. So you do the tours, you get to know the campus, you get to know some of the faculty members, you get to know the other interviewees, and then you're kind of split up and you do the multiple mini interviews. So you're taken to this like office area. It's like 6 different offices. And you have questions on your door, on each door, you have like 3 or 4 minutes for each question. And the questions are along the lines of so one of mine specifically was like, your patient has HIV and they don't want you to disclose that information, or they don't want it to be put in their chart. How do you approach this situation? So in that 1 minute, you kind of just jot down what you're thinking. You go in there, you talk about it. They don't really give you any feedback at all. They just listen. They make a couple of notes. You walk out, and then you go to the next station. So it all happens pretty quickly, and it's a little stressful in the moment, but you just have to remember to be confident in your answers and stay consistent. Because if you go in there and you say, well, if my patient doesn't want me to disclose it, I won't, and then 2 seconds later you can say something totally different, it doesn't look good on you. If you're confident in your answer, whether it's right or wrong, I think that's probably the biggest proponent in they're looking for, is definitely confidence is huge. And another thing, just be true to yourself. I mean, one of the questions was, how do you describe yourself in 3 words? So that's a big question that I think a lot of people get it. I had that at other interviews also, is how do you describe yourself in 3 words? And when you think about it, you're like, oh, I could probably think of 3 words, but they're probably more than 3 words. Right. So you have to pick 3 words that are key. So 3 words that they're going to remember, and 3 words that are going to make you look good. Another question, like, what is your strength? What is your weakness? Those are all trick questions, because whatever you tell them is your weakness really needs to be a strength. So for example, oh, I'm very like OCD and I'm a neat freak. Yes, that can be a weakness to some people, but at the same time, as a dentist, that's kind of a great thing.
You want to be meticulous.
Exactly. You kind of want that, so it can be perceived as a weakness, but it also can make you look better. So you just really want to be smart in articulating yourself and your answers, and making sure, I think, consistency in your message and consistency in the confidence is, I think, huge. So we had those. You have like 6 questions, things like integrity and just to get to know your character. And then you go and you have the meeting with the dean, and it's in a group. So my best advice for that one is definitely to stand out. You don't need to speak up 6 or 7 times, but when you do speak up, make sure whatever you're saying is going to leave a lasting impression. So whatever you say, make sure it's kind of short and straight to the point, but whatever you're saying, make sure it's like wise. You're not just like blurting something out just to say something. Whatever you say, make sure it's something that's going to leave a lasting impression.
And make an impact.
Exactly.
Definitely. And you actually said something very important when you said to be true to yourself. I think a lot of people go into these interviews and they try to put on this persona of what they think the dental school wants to see. But like, I think that's the worst thing that you can do, because like people can tell when you're not being authentic, so everybody listen, always make sure that you are authentic.
And don't be so aggressive at the interview also, because in that meeting, I will say there are people that didn't get in who were just overbearing. And as soon as the dean would ask a question, they were always the number one person to say something, and just to say something. Whatever they were saying was usually rubbish.
Right.
They just wanted to talk and be the center of attention. But I do remember a lot of the people that were in that meeting, and some of them are actually in my class now. And it's funny, they were the ones that were, just making the few short, powerful comments and just saying something that is going to leave a lasting impression and just show your personality. So if you're very quiet, that's your opportunity to show the dean that, yes, maybe I'm a little bit more reserved, but I bring something to the table. And here's what it is. In this one sentence, I'm going to blow your mind, and you're going to remember this.
Right. Well, that's huge. Greatly said. All right. So you interviewed, and obviously you got in. So my next question is, how was that transition? Like, what was the first week like? Did you all have some type of orientation, or did they just kind of throw you into the fire and say go?
Yeah, so we did have orientation, and orientation was a lot of fun. I mean, it was a great opportunity to get to know your classmates. And I mean, we were in class and we had clinical sim clinic and everything, but it was a little bit more chill. We got to know the faculty really well. It was a great opportunity for people to ask questions, get to know your classmates, because that's when people started, running for president and getting their name out there and starting to figure out who's their clique and who do I sit next to and all that. So it was really fun. And being in a smaller class, we got to know each other very quickly. So there's 64 of us. So it's really not that big. Took like a week before I knew everybody's name.
Right.
So,
Right. Okay. Good little transition. That's good. And I mean, I think that time is so crucial. You need to know that these are going to be the people that you're going to be spending the next 4 years with.
Exactly.
So establishing a good connection early is extremely important.
And definitely being respectful. I would say, because you're spending 4 years with these people, it's important to just be respectful. You're going to meet people that are totally different from you, coming from all different walks of life. I mean, we had people, I took 1 year off and I was one of the younger people in my class. We have people in their 40s in our class. So you're going to meet all sorts of people with kids, some that are, married, getting married, single, whatnot. So it's just you don't know who's been through what. So just being respectful and not making any like bold statements too early on so people don't rule you out.
Yeah, true. No, that's very true. Just be careful.
I know what somebody else has been through. But it was honestly for me, because I'd only taken 1 year off, getting back into the study grind was not really so hard as for other people who I know had taken like 3-4+ years off. Yep. But I do think even for those people, they were so excited. All of us were so excited to be there. So excited to have gotten in somewhere that, you kind of just fall right back into it and you're ready to start studying and you are motivated.
Right.
It wasn't as challenging, but it was really important for me, at least, to develop like some sort of routine. Yeah. So whether it was taking a break and going to the gym when I'm burnt out and giving myself like a mental break, or meal prepping, or whatever I was doing to kind of stay on task, that helped me kind of stay in the groove of things.
Right. Great. Okay. So now our viewers love to have like a day in the life type of situation, right? So they love to hear what it's like to be a D1 at your school. So if you could just kind of give us a timeline of how a typical day would go.
Yeah, so classes here start right at 8. most people are here at like 7:30. People are here early, getting ready, getting settled into class. So class starts at 8. First year, you're taking a lot of biomedical sciences. So you had your immunology, microbiology. We also had, because our school has a pretty high focus on public health, we had epidemiology. We had some public health courses mixed in there. In terms of dentistry, we had dental anatomy, we had cardiology, and then we were in the sim clinic twice a week. So Monday through Friday, every day it started at 8 regardless, but it wasn't always in a classroom. So maybe your class started at 8 and it went, I think our blocks were like 8 to 10 and then, or 8 to 9:50 and then 10 to 11:50. Then you had like your 1 hour for lunch and then right up again at 1 to 1:50 or 2:50, depending on the class. And then we were done pretty much by 4, I would say, in first year with didactics, unless it was a sim clinic course where a lot of people stayed after. People stayed, they practiced. Faculty wasn't always there, but we always had TAs there helping. So that's pretty much how it was Monday through Friday for first year.
Great. Okay. And so, say somebody's listening to this interview right now and they say, you know what, Yalda has convinced me. I want to go and apply to UNE. What is something that you think that they should make sure to have on their application? Like, is there anything that, I mean, I know you did mention public health or whatever it may be, but is there anything that they should definitely make sure that they have on their application if they're going to apply to UNE?
Yeah, definitely. There are a lot of great things about our school that I think people don't realize. One of the main things I think is just the amount of clinical experience you get here is, I mean, I don't think many dental schools get this much. And I think one of the main reasons is because we don't have specialty programs. So if a patient comes in and it's molar endo, we don't have an endo resident fishing that out of our hands. You're doing it. And you're going to slap a smile on and you're going to sit there and you're going to do it. Obviously you have help from a faculty member, but you're up to the challenge and you're the one doing it. So I think it's definitely putting that somewhere in the application that you're ready for the challenge, that you are open to that. We have a program, it's vertical integration. So you work with the older classes a lot, even starting in your first year. You go up in clinic and you're not necessarily working on the patient, but you're assisting from very early on. So they love to hear about that. Admissions loves to hear that you know about that you know that we do the vertical integration. The mission statement at UNE talks a lot about access to care and how there isn't a lot of access to care in the state of Maine. So just acknowledging that and, writing somewhere in your personal statement or writing somewhere in your, the other letters that you sent in your application, there's
Supplemental,
yeah, writing well aware that there is not a lot of access to care. And I mean, that's a priority to you, that you want to make sure that there is more access to care. That's huge. Definitely the clinical aspect, I think, is really big here at UNE, just acknowledging that we do get a lot of experience and that you're interested in that and that you've heard about it and you know that people who graduate from UNE usually have that opportunity. I think that's huge to talk about. And yeah, I think those are some key things.
Okay, those are gems, guys. So please listen to Yalda if you all are interested in applying. Make sure you write that all down and put it on your application.
Write it all down and add that into your
definitely. So I know that you mentioned that you work out. And right now, the whole topic of mental health is huge. So I wanted to ask you, is working out, or how do you really balance your mental sanity, or, that work-life balance, all of that, all into one thing? How do you manage all that while in dental school? Because I know that's a huge topic. It's a huge topic right now.
That mental health is so important. And I think that, for dental students, because we're working so hard, it's so important to keep your mental health a priority. I mean, when you're studying so much and you're putting in so much time and effort into your schoolwork, studying for tests, just clinical work, patients, keeping that all organized, you really have to make sure to take time for yourself and stay sane. I mean, school obviously is of the utmost importance. That's your priority. That's why you're here and that's what you want. But, you should definitely make time for yourself, because you don't want to bog yourself down to the point where you start losing touch with, your sanity and everyone around you. You don't want to close yourself off from everybody, because your friends and your family, they can be a source of kind of just help and to just de-stress from all of it, because you're with the same 64 people every day. You need a break. I can promise you, you are going to need a break.
Right.
And if you're putting your best foot forward every single day and you're putting in a lot of effort to school, it's okay to go out. It is more than okay to take a break, go on a vacation. I mean, self-care is very important. And if you don't, take care of yourself, what do you have to show at the end of the 4 years? Because you're not going to make it. I can promise you, you're not going to make it.
I completely agree. Because dental school will run you down if you let it,
You have to take a little bit of time for yourself. I mean, it's really important, I think.
It is.
I do definitely take a lot of time for myself when I need it.
Right. I mean, of course, there will be those times where, you have to really lock in.
Yeah,
and you have to spend those 10, 12-hour days studying, do whatever it may be. But when you are able to take a break, you have to.
Yeah, especially at the end of like a big block, when you've taken like 6 exams back to back, you don't need to go back to the library. You need to take the weekend. You need to relax. If that test is in 2 weeks, you have 2 weeks.
Exactly. Exactly. All right. So clinic. I know you are in clinic now, but what is the kind of clinic process at your school? Do y'all start seeing patients or helping out with patients your first year, or how does that all happen?
So we actually start really soon. First year, we're not seeing patients individually, but like I said, we have that vertical integration program. So we are going upstairs and working with a D4 and just kind of, they're showing us the ropes. So they're maybe walking us through how a screening is done or a comp exam, or we're just watching or suctioning for them. So you do have that initial patient interaction. So it builds your confidence early on, and you see how to deal with patients and how to manage them. So I think that's more of like a patient management exposure. But we do start first year. And then in the summer of first year, going into your second year, that's when you're more upstairs 1 day a week. So right now I'm paired up with a D2, and she comes upstairs every Thursday afternoon, and I pretty much let her take over. So obviously if she has questions, I oversee her and I help her out, but she has a lot of control in what happens in that appointment, a lot of responsibility. So in your second year, you're up there and you're not doing anything super complex, but my second year, she did an extraction last Thursday and it was great. She did an amazing job. And she's had a decent amount of exposure at this point where, same thing. When I was in her shoes, my partner was letting me do a lot of things that we had practiced on each other. So that was cool. And then now that we're in our third year, Monday through Friday, our clinic is open. The fourth years are up there Monday through Friday. And then as a third year, we're up there Monday through Thursday. And then Fridays, we have a full day of class.
Okay.
So it's pretty cool. I mean, I would say for sure we do get a lot of clinic time, and I'm obviously happy about it. Can't complain. But it was obviously scary at first. I mean, you go up there as a first year and you're like, what is going on? I mean, you don't have a ton of responsibility, but I think it definitely helped me become more comfortable around patients. Just seeing a fourth year in my first year interact with a patient gave me a really good model versus as a first year going up there and working with a second year, which is why I really love the vertical integration program that they have here.
Great. And so you've spoken very highly of your school. You've listed off many advantages. But now I kind of want to hear a story. Was there ever a time that, something happened at your school and you were like, wow, this is the exact reason why I came to UNE, or wow, this is why UNE is so unique? Anything like that has ever happened to you?
Yeah. I mean, a bunch.
Yeah.
I can't stress enough, and I think it's more because I'm realizing it this semester specifically. I would say coming to UNE, I was really excited. I love the facilities, and that was a huge reason why I came here. I didn't realize how much clinical experience I was going to get until I talked to other students in other schools who are in the same year as me, who, maybe haven't even really, well, that's not true. They've touched a drill, but they just haven't. And for me, I'm like, I can't imagine not doing some of the things that I've done, because when you graduate, I don't really feel like at this point in time, I absolutely need to do a GPR to get that additional experience. When I talk to some of my friends in specialty programs, they tell me that it's crazy that as a third year, I've placed an implant. I mean, obviously I've done it with the oral surgeon was helping me, but I had a lot of responsibility in that case. Or molar endo is something that I was terrified of, absolutely petrified when we learned about endo, and then went upstairs and one of my first patients was number 18 endo, and I was horrified.
Right.
But I was working with a really great D4. He walked me through it, and we got the case done, and it was great. And I just think that the exposure that I've had for sure has made me such a better provider and allowed me to challenge myself in ways that I was not anticipating. Whoa, lights out.
That happens. Let me just like, I don't want it. I don't want it to go out.
But yeah, I mean, definitely a lot of really good experiences. And I'm very happy that the faculty are so supportive here, because I'm so glad that we're doing these things now and not, fresh out of school, because you have somebody with, 20, 30 plus years of experience to turn to. If anything happens, they're right there and you just ask them for help. So it's really nice. It's good experience. Because in this day and age, technology is such a big thing, and it's advancing at a rapid rate. It's crazy. Like every day I see something new on Instagram about this new technology that's out, whether it's like with implants or with intraoral scanners or whatnot. So kind of learning some of that and getting adjusted to that has been really helpful too. Like learning how to use a CEREC machine was a learning curve for sure. But so yeah,
at least you're exposed to it. No, that's awesome. Okay, so last thing, you've been great. You have been amazing. Last words of advice to somebody who might not even necessarily want to go to UNE, but they're applying to dental school. Do you have any just like golden nuggets that you would want to tell somebody in that situation?
I would say for sure, do not give up. I have talked to so many people, so many dental students or pre-dental students who were just so discouraged because maybe their DAT wasn't a 23, maybe DA wasn't above a 3.5. And, you see these things on these websites that tell you this is what they're looking for, but that's not the only thing they're looking for. Yeah. You might not have a great GPA, but maybe your DAT score blows it out of the water. So every application is different, and admissions committee, they look at everything as a total package. So just because you're falling short in one category, definitely by no means does that mean you should give up. You should totally keep trying. And if you're passionate about dentistry, that is 100% going to show in your application. And as long as you stay consistent in your application, and, my application, for example, had a theme. My theme was public health. If you stay committed to that theme in your application, it will be very apparent to the admissions committee, and they're going to love you. They're going to meet you, and then they're going to be sold. But unless you push yourself and unless you really dedicate yourself to that application, it's not going to happen for you. So don't give up just because somebody else with the same DAT score didn't get in, because they might have been lacking on something that you're excelling at, or they might not have had all the shadowing experience, or, they didn't maybe do a service trip. There's tons of things that you have that they don't. So definitely don't give up just because of somebody else's experience.
Great. Couldn't say it better myself. Yolda, if you can you provide people with some type of contact information so that if they do have any questions that they want to ask you about your school, or just, you being a dental student in general, they can reach out to you at?
Yeah, of course. So I have an Instagram. My Instagram is Loops and Lipstick. And then you can email me if you'd like, if that's easier. My email is right on my Instagram, but it's yrostamnajad@une.edu. And I am always here to help. I love answering questions because I remember being a pre-dental student and I remember the struggle. And I'm so grateful for all of the people that answered my questions and helped me get to where I'm at. So I am always willing to help.
Great. Everybody, Yolda is an amazing resource. Please reach out to her if you have any questions. Obviously, you can tell she's a very personable person. So definitely don't be shy.
I am here and I will answer, slide into my DMs.
Right. But y'all know, on behalf of FutureDDS and all of our subscribers, you know, we want to say thank you once again for a great interview and really sharing your time with us.
Thank you.
No problem at all. No problem at all. Everybody, if you haven't already, make sure you go and hit that like button. Also, right? Also hit the subscribe button and the notification bell so that you know whenever we post new content. But until next time, see y'all later.
Bye.